know a bit who you are here. So we're going to not send around the mic because it's not working. So we would love for everyone just to tell who you are. And then she's going to speak for 20 minutes, something like that.
Not more.
Not more. And then we want to have a discussion. So I hope that we just can go row by row, but people saying, what did you want to know exactly?
Yeah, just what. It's not working.
Sometimes it's working, sometimes it's not working. Let's try.
Let's start. So I'm a sociologist, a researcher, and before telling you about the research we are doing now, just say a few more words about the CREMIS, so the research institution I'm working in now. This is a non-profit research organization that is linked to the University of Montreal in Canada. And it's also linked to the Ministry of Health and Social Service of Quebec, so that's a Canadian province. And in this CREMIS we are doing research. I'm doing research together with social professionals, especially community workers, and together we are doing research in which sociology and social practice are supposed to come to good questions and some analysis of the target groups of the social professionals and how things can be better tackled and what are the problems target groups are facing. For myself, in my own research, I have special interest for poverty in urban settings, namely in mixed areas like inner cities where very poor, marginalized people are living, like the homeless, like beggars, but they are not welcome in those public spaces. There are so many other users of this public space, and sometimes there are conflicts, and what to do about this conflict. That's a question. This question is very important for me. So the research today, I'm going to speak about a research project that we are now doing, but just starting. So what I'm going to tell you is more research questions than results. And first, a little words about the research design. The official name of the research project, that's Citizenship and Proximity in Urban Settings, Lessons from the Practice in Canada, namely Quebec, the Netherlands and Spain. This research is commissioned by a French governmental agency that is interested in social practice towards very marginalized groups who are not enjoying the social rights that they are entitled for. And some of these people are even reluctant. Some are not enjoying their rights, but some are even reluctant to get the rights to which they are entitled. Why? What can we do about it? In some cases, there has been even violence towards social services, like maybe you heard in France some years ago there were some riots in the suburban areas in which some young people even put fire to public buses, but also social community centers. Why such violence? What to do about it? So that's the general background of our research project. In France, outreach work is not a widespread practice. I noticed that there's no French people around. Probably I'm the only one. In French social policy, the accent is put on the theoretical provision of social services, of social benefits, but much less attention is paid to the effective availability of social policy. So our research is a chance to let our French colleagues know a little more about outreach practices in countries where it is more developed, and also about the challenges met by outreach workers dealing with marginalized groups. Not only youth, but of course youth is involved in our research project. So a particular point of interest for us as researchers in this project is the discussion about outreach as a tool for social inclusion of marginalized groups. What kind of inclusion is involved? Outreach can be a means to reach young people and pull them back to the system, to school, to work. Let's put it in very brief way, the top-down perspective. Outreach can also be a means to reach the young people and to get to know about their views, about their problem, and to set plans together with them on the basis of their expectation. Let's put it the bottom-up perspective. So in theory, as a researcher, we are more interested in the bottom-up perspective, but we are wondering, how is it possible? And what to do about the expectations of the target groups once they are expressed? What are the difficulties met by outreach workers? What are the limits? And what are the strategies to overcome difficulty? Outreach is not requested by target groups. Can that be regarded as intrusive care? We're also wondering, what do the target groups think about outreach practices to address their needs, their problems, the problems they are facing? Is it useful at all? How far it is useful? And if so, do they feel more comfortable with the bottom-up approach or the top-down approach? Maybe those questions look a bit provocative to you. They are very open. We are very open to many views, and we like to understand better what outreach may be in different settings. We think those questions are not only interesting for the researchers and the French governmental agency, but we think and we hope it's also a chance for outreach workers to consider the view of the target groups as a means to strengthen the legitimacy of their field of practice, or to make it more obvious. So that's why, maybe that's also a point for discussion. So, a little more about the fields of research that we are considering. We are considering outreach projects that are relying on some social professionals. Sometimes some volunteers are involved, but there is at least one professional coach in the project. Workers involved can be regular trained outreach workers with education in the field of social practice or the like, and their expertise is more on how to reach the target group based on specific education. there can also be, we also have some interest for peer projects in which people from the target groups are doing outreach, and their expertise on how to reach the target groups is based on their own life experience, and also coaching. We are interested in outreach projects that are not only aiming at healthcare or harm reduction, but also social inclusion of the target groups. There are 3 cities involved in the project: Amsterdam, where we are mostly interested in detached youth work with so-called bothering youngsters in deprived settings, with some questions that very similar, that the problem with the French suburban areas is the point to get them off the street or to provide them with alternatives. In Montreal, we are especially interested in practices related to the city center, downtown Montreal, with both affluent and poor people of different kinds, drug users, homeless, sex workers, socially isolated residents of social housing units, many kind of people. Sometimes they fall on several categories. And in Barcelona, we are especially interested in outreach work with migrant people from the 1980s up to now. So I've brought a couple of pictures just to put some faces on the practices that we are interested in. So this is downtown Montreal, which is a very mixed areas with both lots of shops, lots of entertainment zones, and also a lot of students, and also some people who are outside all year, including in wintertime. Then you can see that there is snow. The distance is lying in the snow, and that's so during 4 or 5 months a year. This is also Montreal downtown with a new regeneration, urban renewal project in which previous factories buildings are now replaced to huge entertainment theaters, leisure centers. And this is also Montreal downtown. This building, really in the inner city of Montreal, and this is the Cactus project. That's a drop-in for drug users, and they're also doing some outreach work dealing with social inclusion as a purpose. This is Amsterdam. Probably those of you who have been to Amsterdam have been there, because it's a very, very highly visited place. That's a Damrak. And Amsterdam, that's also quite a place, quite a popular place with sex workers. And so this is the red light district, where you can see sex workers in the window shops. Those are not so much concerned by outreach, because they are regular and they're legal and they are protected by the police. But there are also some sex workers that are in the streets and it's not regular, and there is a workshop dealing with those issues at this conference, so you have more chance to hear about it. But what we are considering in our research, that's more outreach practices with young people in the suburban areas, such like this. Well, this picture was not in Amsterdam actually, but in Rotterdam. But anyway, that's very much the places that we are investigating with a variety of users, space users. That can be children, that can be youngsters, that can be elderly people, and we are considering the young people that are sometimes as targeted as labeled as threatening young people, and they are supposed to get out of the streets, which brings intense discussion about within youth workers nowadays that are a bit like trapped between, sometimes trapped, but anyway questioned about their educational practices versus repressive approach towards the youngsters, or collaborating with the police in repressive approaches. Some results, preliminary results. So we noticed that most of the practices, or I would say all the practices involved are based on the crucial point is building a relationship with the target groups based upon mutual trust. These results, that's just for the time being, that's mostly about literature review and preliminary contacts with the research the project we are investigating, but we don't know so much now. We have planned some interviews, in-depth interviews with outreach workers, and also some focus group with the target groups, but that's more to come. We haven't done it yet. In the practices we are investigating, we noticed that there are sometimes individual stages involved and also collective stages. Mostly they are combined according to the needs of the population, the target groups involved. We noticed that some projects are very ambitious in terms of social inclusion, involving the target groups in the planning of some activities, like for instance in the Cactus project in Montreal. The drug users are also invited to take part in a group in which they are setting the agenda for the activities, and they are also taking part in developing some political action in the local scene. So that's, in terms of social inclusion, it's very important because it reaches the political arena, to which they are, in general terms, most generally absent, not only because they don't vote, but also because they are not involved in some social movements. So that seems very interesting. In Amsterdam, there are also some community centers in which the youngsters are invited to discuss the internal rules of the centers and set the rules together with other users, with the coordinators, and that's also very interesting. We also noticed some difficulties met by outreach workers. The trust relation can, in some cases, be a trap, because if there is no trust relation with the youngsters, then the outreach workers cannot do anything about social inclusion. But sometimes this trust relation is challenged by the youngsters. For instance, it can happen that some youngsters ask for let the outreach worker or the youth worker know about their criminal activities. It's usually petty crime, but anyway, it's illegal. and then the outreach worker has know about it, and of course he doesn't like it, and he may report it to the police. But if it reported to the police, then the trust relation will be damaged. So there is a question of how to set the limit. So that's an important question. And regarding the criminal behavior of some youngsters, and again there is the question of the limit regarding what is democracy within a group. And we noticed that in some projects in which the youngsters are invited to take part in collective activities, working in a democratic way, what is commonly heard as a democratic way, is not obvious for these young people, some of these young people, and there is a question of the pedagogy of democracy that is involved. Some of them are very tempted for very top-down, hierarchical relation, and of course that's not the purpose for the outreach workers. But then there's a question of discussing what is democracy and what are the limits of democracy. Another difficulty that we noticed is that sometimes reaching the hardcore of the problem is difficult when outreach workers are outsider, and so there is the question whether the hardcore of the target groups can be better reached by peer workers. But then when it's about peer workers, then there is the distance built by professional, regular outreach worker that is sometimes missing to address some questions relating, for instance, the pedagogy of democracy. So how is it possible to combine these different types of outreach in a spirit of cooperation rather than competition? So that's also a question that we notice. So I'm talking about the difficulties, but some of these difficulties, most of them are discussed by outreach workers in the different cities involved, and some of them are developed strategies to overcome these difficulties, like, for instance, with the issue of young people reporting their criminal activities. Some outreach workers clearly state that they don't simply want to hear about criminal activities, and it's sometimes a good way to prevent these problems of having trust relation as a trap, and can also some other difficulties like having in the same group different people with different in different stage of social inclusion, people who are who have had some experience in being part of a group, or sometimes it's difficult. We have been involved in a collective project for some time. Sometimes it's difficult for them to accept newcomers, people who are at the very first stage of social inclusion. And there are also some animation strategy developed by outreach workers to overcome, maybe sometimes split between different groups, with some groups with newcomers, people who are still very far in marginalization and who are not yet ready to be part of a collective group, and to have them aside more in some activities like in drop-in centers with mainly welcoming them and to relax, to have a shower and to discuss about their individual needs, and some other groups, different groups with more collective, with people who are already in a better mood for collective activities. So collective activities shouldn't be like, let's say, compulsory. So, well, that's about it. Maybe we can continue with the discussion with you. What do you? Just one more thing. That the question about how the point of view of target groups are involved in some project. I forget that. That's very important. Up to now, we noticed that there is more projects who are actually involving the point of view of target groups than research into the point of view of the target groups about outreach workers. Actually, the question of how the target groups consider the practice of outreach workers has not been much investigated among the social scientists. On the contrary, there are many projects that are involving the point of view of the target groups, and there are also practices and in which some outreach project in which scientists is involved in the coaching and the monitoring of the project, and that's also a good way for scientists to know about and also coordinator to hear about the feedback, to get some feedback about how the target groups regard the outreach practices. So may I ask you now whether you have any question about this presentation? I'm sorry, my English is not really good, and I hope it's not so much a problem. And if you have any question, I'm glad to hear. Maybe we can go on with the discussion about how the point of view of young people is involved in your practice. Does the fact that it is about youth makes it any difficulty in involving their point of view? And I have also other questions for discussion, but maybe that's good to start with some question from your side about the presentation. What do you think? Yeah.